All right. Hello, everyone. Thank you so much for hopping on. My name is Ransom Anima. It's your first time of seeing me. I'm a final year radiography student from Nigeria, and I'm also a medical writer, also a YouTuber. Today, I have an amazing guest speaker today, a medical doctor in the UK. So she has a lot of things to share if you're attentive to this mental chat. So, Dr. Adana, could you introduce yourself to the audience? Thank you.
Okay, well, like you already said, my name is Dr. Adanna. I am an Igbo Nigerian. I'm currently residing in the UK, and I think for now that's it for me. Hopefully, as we get talking, you get to know a little bit more about me.
Amazing. Amazing. So,
Mhm.
Dr. Adana, we have a couple of questions for you to answer. And
Okay.
you ready?
Yes.
All right. So, the first question is now tell us what really inspired you to pursue both medicine and public health, and how do these fields intersect in your work as a medical doctor?
Okay. I think it started when I was in high school. So I always knew I was going to be a doctor. Initially, I was going to be a doctor and specialize in psychiatry. So that was my goal for a while. And then Ebola happened, and I was a prefect in secondary school. So we had a lot of active interactions with people who were giving us instructions. And I took very keen interest to that. So I researched on it, like who are the people who handle pandemics, epidemics, endemics, and I realized that they are public health professionals. And that was interesting for me. So I was like, oh, that's cool. And then I went on ahead to go into med school. And then in my final 2 years of med school, predominantly during my clinical rotations, COVID happened and I played a more active role. So I would volunteer to give vaccinations and I got talking with a lot of the healthcare professionals. And I realized that what all of them had in common was that they either had like a background in medicine or in nursing and then went ahead to do some sort of training in public health. And I'm like, oh my God, like this has been something that has been on my mind for a while. And the more I researched on it, the more I realized that a lot of the things I wanted to do in terms of psychiatry, so when I think about like health promotion, community health, those are things that people who have like an MPH or who actually go into public health specialty training, which you can actually do. So I'm like, maybe all the while I really just wanted to do public health and I misunderstood it as psychiatry. So I was like, okay, I'm going to do a master's in it. And I did. And honestly, to date, it's honestly been the best experience because 6 years of medical school, you're looking at a patient as an individual. What Public Health Hub now does is it takes all those individuals and they bring them together, and you're looking at them as a population level. So you see your patients as a doctor and you think you're just seeing one person. But the moment you realize that there are probably a million other people that are facing that same thing, you want to be able to think creatively, like, okay, what can I do that would make sure that like in the next 1 month I'm not seeing multiple people like this. You want to be able to implement change and care that would, affect everyone. I think it's like vaccinations. When you give people vaccinations, you now create like a herd immunity. So it's like, what can I do that will help this person and also help every other person? So it basically brings both of them together and you're able to provide better care. Yeah.
Mm. Amazing, Dr. Adana. Thank you so much for
You're
talking us through about what really inspired you to pursue both medicine and public health, because these
welcome.
are really not easy courses to do in the medical field, and
No.
how those two fields intersect in your work as well. And I love the fact you mentioned about seeing patients as an individual. So before I proceed to the next question, Dr. Adana, what do you think is the major problem that public health professionals are facing right now in the UK?
Uh, right now, I it would be more of what I would say the healthcare professionals are facing, because with public health professionals, so much as all other professions, is implementing the change. So I can sit here and have so many ideas. We can be having so many conversations, But what are we going to do? Are we going to get approval? Are we going to get the go ahead from the government, regardless of where we are, the UK, the US, Nigeria? Do we have the go ahead to actually proceed to do these things? So I think it's the implementation, from the funding to people actually seeing these things as problems. So it's like you see it as a problem, your colleagues see it as a problem. There's data that actually suggests that it's a problem. But do the people in power actually see it as a problem? If they don't, there's no moving forward.
Mm. I think thank you for expatiating on that. All hands on deck to solve a problem.
Yes.
That summary of what you just talked about. Thank you so much, Dr. Adana, for talking us through on the major, restraints healthcare professionals are facing in
Yes.
general. I think
Mm-hmm.
it's kind of like an educating disclaimer to the audience as well. If we're gonna make the healthcare system a better place, I think we should have all hands on deck to
Definitely.
solve that problem. It's gonna be an
Mm-hmm.
amazing thing to do. Thank you so much, Adana.
You're
So the
welcome.
second question is, all right. So she's a mental health advocate. So I want you to tell us, Dr. Dana, as a mental health equity advocate, what are the biggest systemic barriers to mental health access, and how can we address them?
Okay, I think that's a very nice question, and I would think I will answer it from the perspective of a Nigerian. I know a lot of people will be like, "Oh, nobody likes to talk about Nigeria more than the people who are not in Nigeria." But I grew up in Nigeria, so I can talk about it. I think it's the fact that it's not considered real in court. So, for example, you tell someone that you're feeling down, they're like, "Oh no, just shake it off." I mean, sometimes you need somebody to show you some tough love, but the fact that across Nigeria, like 90% or 85% of people don't actually consider it as something that is serious. So let me give an example. Recently, when I was still completing my master's for my health governance model, I had to critically appraise and like evaluate a system, and I decided to do it in Nigeria. And for you to bring that to life, it's easy to use a disease or a condition. And I'm very passionate about anything mental health and women's health. So throughout my master's, if I had to do any assessments, I would link it to them because you have free will to choose. So I chose depression, and it broke my heart writing that essay because so many things. For example, there are a lot of papers out there that just talk about how a lot of people associate certain medical conditions to like cultural beliefs, spiritual beliefs. And I'm a Christian, so this is not something I'm saying to disrespect anybody, but sometimes you need to seek help. Most of the time, you need to actually seek help. The fact that we don't consider these things as real is already a limiting factor. When we think of the Mental Health Act that is actually implemented in Nigeria, it's good in theory, but if you read it, like if you take your time and actually read it, you realize that it's nothing but words. It's like the actual implementation, the execution, these medical medications that are for like depression, psychosis, bipolar disorders, they're not covered by insurance national wide. So it's like, okay, what are we doing? That means you guys don't consider that this thing is actually real. So these conversations, we need to start having them so that we can create some, buzz, and then hopefully actual change happens. So that's something I feel like is really huge, is the fact that it's not considered real, like in court. Because obviously we all talk about it. There's also the social media movement of it, which I'll try not to talk about too much because I have very strong views as to how it's portrayed on the media right now. But I just feel like if we really have this like real conversations about it, we would be able to move forward. Yeah.
Amazing. Thank you so much, Dr. Dana, for talking
Mhm.
us through. You know, as a mental health advocate, the biggest systemic barriers to mental health access and how we can address them. So before we proceed to the next question, Dr. Dana, there are people faced with depression, faced with mental health challenges, but they can't voice out. So, what are the things do you suggest that people that they don't have the voice to, talk about what they're passing through because they're ashamed or something? They can't see the therapist because because I have a friend in the UK,
Mm-hmm.
and she was sharing a story on how her friend, whenever her friend wants to go see a therapist, she has to wear a face cap, cover herself very well, so that her friends will laugh at them, at her, because of they'll be like, "Why are you going to the therapist? That means you're not feeling okay. You're doing that. You're doing this." So, in your own perspective, with Adana, how are you trying to break that barrier of people being ashamed of themselves, faced with depressions and mental health crisis? How are you trying to be the voice of the voiceless?
I think right now, one thing I try to do is to just organically bring it up in conversations and also talk about it from my own perspective because we're human beings, we're not robots, we're not, just bringing it up in conversations. And also, if I ever see something on social media that I think is valuable, I would always share it. So if I see someone who is offering like free consultation calls or like you can drop me a message, it's something I always tell my friends also to like if you're feeling anyhow, leave me a message. I'll help you. I will get the help that you need because sometimes you may not even be in the position to help them, but knowing that this person is going through this thing, you're going to start actively thinking about it like what can I do to help them. And I think with people who are currently surrounded by people who don't take it seriously is to really advocate for themselves, which is something that I'm very big on in terms of women's health because there are so many conversations with women's health that people don't take seriously because they just consider it as normal for every woman. I think that's also very similar with like mental health. Like, oh yeah, everybody feels sad. Oh yeah, everybody. No, you need to advocate for yourself and put your feet down. Like, I'm feeling this way. I know I'm not supposed to feel this way, and I would like to seek help. And if they are not taking you seriously, that's fine. You seek help. It's easier said than done. I know that it's very easy to say, but you just, sometimes if all you have in you is to send someone a message and say, oh, I need help or I need someone to drag me out of this, please do that. You can always message me also. Like, I'm constantly responding to people. I know I'm happy to do it because like we need to help each other. It starts with the conversations we have in our regular day to day, and then when you start having those conversations you see people who implement it in their workplace, in school, in practice. You have to try and create a safe environment. So if I create a safe environment with my friends, if you go to school and create a safe environment with your friends, those people also go. Like, do you see how it just continues to spread? So we have to start in our day-to-day environment so that those people that are around us will feel safe to talk to us, and then we can now seek out the help. Even though depending on where you are, the help may not be readily available. But what I tell people is that you should use social media to your advantage. These days, there are so many platforms, like so many platforms. You can just Google it. Like, it might be an online resource or someone's platform, you can message them. And if all of that isn't working, maybe if you're someone that like believes in faith, you can escalate it to the church or talk to someone in your school, but just keep trying, and then hopefully you're able to get the help that you need. Please speak up at the end of the day because yeah, we're here to help you. I'm here to help you, like.
Amazing, amazing nuggets right there. So it's in a nutshell, you have to speak up because if you don't speak up, nobody's gonna help you.
And
If
sometimes nobody will really know. That's I think that's the painful thing about like mental health conditions. Sometimes it can really fly over your head, and not because you're not a sensitive person, not because you don't know your friends or family, not because you're not paying attention, but sometimes the signs are not there. Like, some people are really good at as coming off as bright, and sometimes you as an individual, you have to obviously give room for everyone. You don't know what people are going through, that's right, but sometimes you just don't know, and you won't know if someone doesn't say something. So I think, like my friends and I, we have like a group chat where we don't talk on, but like if something is going on with either of us, someone just sends a message there. So if any of us ever see a notification on that group, we know that, something is up. So you can create devices, like even if it's a word, like, oh guy, if I text you apple, know that I'm not okay. So that you feel safe about it. Just create something that works for you, that you also don't feel ashamed of, so that you know that you're actually speaking up,
Mm,
basically.
mm, mm. Amazing, amazing. Thank you so much,
Mhm.
Dr. Dana, for that nuggets, and I believe that the audience are really, enlightened the more about speaking up if they're faced with depression and anxiety and mental health challenges. I think there are
Yeah.
technologies now used in healthcare to diagnose or diagnose depression right now because you know
Oh, really? I don't think I mean, I think we do it this textbook way. Like, if someone presents with a particular symptom, you grade their mood, you look at the time, and depending on the symptoms, you can also now classify it if it's mild, moderate, severe. They may be, but as of me personally, I don't think I've been exposed to technology in that area yet. So,
amazing. So, Dr. Dana, thank you for talking us through about that. But I want to, before we proceed to the next question, what is the prognosis for you know depression, like you talked about, like, severe and, mild to something like that. Do you think if those tests are, come out real, that the person is, with the symptoms like you talked about is
mhm.
facing kind of like depression or mental health challenges, do you think the treatments are poor or
Mm.
neutral? What do you think?
I actually think when done right are good. Like people can actually, I don't want to say recover, but maintain good stability. Like they could enter a place of like remission. So for example, if we talk about people who are bipolar, like by diagnosis, because we don't want to call people by their condition. If we talk about people who are living with bipolar disorder, that's a better way to put it. You see a lot of them who talk about how, like, they haven't had an episode for a while because they're taking their medications well. They are probably going to the talk therapist, for lack of better words, regularly. But those are in places where there are systems in place to support them. They are also going to support groups. So I don't think one thing would help better than the other. I think it's a basket of things. So sometimes if someone has like mild depression, we don't jump straight into saying let's place them on antidepressants. We would want to recommend them what we call lifestyle modifications. So you want to talk to somebody, we can refer you to a support group, because the truth of the matter, even biblically, it's there. What you're going through, there's someone under the sun who is also going through that thing, and that doesn't discredit or disvalue what you're feeling. What that means is that you will find your group. Sometimes you have some weird things in your head, and then you hear someone say it to you, like, oh my god, like, I'm not mad, like, people, yes. So that's the beauty of support groups. You go there, and then you realize that, okay, what you're feeling, you're not numb, like, everything is fine. People are experiencing those things too, and they're able to hold your hand. Well, my problem is that these things are not everywhere in the world. That's the truth of the matter. So when we talk about like people who are dealing with alcoholism, there is Alcoholic Anonymous in the States. We have clinics here like that in the UK. I'm not familiar with any in Nigeria. They may be, but you see, even if there is, the fact that we don't know about it is a problem. Like, do you get? They may exist, but the fact that we don't know about these places, this support, is already a problem. So basically, back to your question, the treatments, I think when done well and when executed as like a combo, really present very, very, very good results. Yeah.
Mm, amazing, amazing. Thank you, Dr. Dana.
Mhm.
So let's proceed to the next question. How do you envision the future of healthcare transformation, and what key policies or innovations do you think are the most needed?
Okay. Huh. I mean, we're all seeing what's happening. Everybody is advancing towards artificial intelligence, the involvement of technology. I'm very big with femtech. I actually am doing work in that regard. But I think there's something I would always want to see, like policies that I feel like should be put in place consistently, even though we can never write off the importance of a human being, is to actually just make sure that there's always a human perspective. Like, we can't, healthcare is one of those things that we cannot solely transfer to artificial intelligence. It's not going to happen. It will not work because you need that human connection. Even sometimes when I'm designing surveys and questionnaires, I always try to implement like an aspect of a qualitative answer where someone can actually write how they are feeling. It's not every time yes, no, I don't know. Like, what if I cannot classify what I'm feeling into those three things? I feel like that's the beauty of like human perspective. So that's a policy that I feel like we should always be placed. And then, the we should always still continue a liaison. I think the word, how I would explain that, is interdisciplinary teams. So the healthcare professionals always working with the public health professionals, always working with the community health specialists, with the social workers. Everybody should still have that space where we all come together and see how we can be better. And now that I've said all of that, I do feel like technology is here for good if we use it for good. It
Mm,
can, produce bad effects if we're using it for bad. But if we want to increase the time from presentation to diagnosis, we can utilize that. If we want to increase the time of seeing patients, so if before we were seeing 10 patients a day, if we want to increase it to like 20, but not compromise the quality of the consultation, we can utilize it for triage. So basically things that will fasten the process but still guarantee the same outcome or even a better outcome. So the moment the outcome that we're getting is declining is when we should take a step back and be like, okay, we're not using technology for what it's designed to be, which is to actually make things better. So we should use it for better, basically.
mm. Amazing, amazing, Dr.
Thank you.
Danma. Thank you for talking us through about your ambition with the future of healthcare transformation and what the key policies or innovations you think are the most needed. Amazing, amazing. I
Okay.
love the fact you made mention about human connections. AI is just there to help.
Yes.
Let's not dispute that fact. But it's not there to just overthrow everything about healthcare now. It's just there
Mm-hmm.
to an auxiliary verb. Auxiliary verb when we were in primary school, like a
Yes.
helping.
Mm-hmm.
So that is what AI is. It's just like a helping tool in the healthcare system because human connections are really, really important in the healthcare system. So thank you so
Okay.
much, Dr. Dana, for talking us through. So we have two more questions for you to round up. So the fourth question is, in your experience, what role do you think healthcare professionals play advocating for mental health equity within clinical and public health settings? What are
Hmm.
your thoughts on?
I think, not I think, I know that one of our biggest strengths is knowledge. You know how these things look like classically. You know when someone's body language is a bit off because you're trained to speak and pick up on verbal and non-verbal cues. So if we were in a room and somebody was a bit distant, the possibility that me and you would notice it before someone else is higher because we're trained to notice those things. So I think using our knowledge to create a safe space for people is, for example, there was a time when I was doing my master's and I had seen someone and I was just like, this person doesn't look like someone who is just sitting by themselves. Like something is off. And I went and I had a conversation with them. And just to summarize that without giving too much information, something was up. And luckily for me, I had the information. So I was able to signpost them to where they were supposed to go. If you go to this place, you can talk to someone. So using our knowledge for power and also creating a safe space for our patients to feel comfortable to talk to us. Like, I know that we're all, busy. Sometimes you go to the doctor and like you've not even finished saying your symptoms. They've told you it's malaria. I'm not done. Like, let me tell you what is wrong with me. No, honestly, create a safe space for your patients. I think it's easier today whilst you're a medical student because at that point you're learning. So you want to follow the template they taught you in terms of your history. I must ask this, I must ask that. You're taking your time, but take that into practice. Like take that into practice. Let people always feel like there's a safe space. Leave, we call that safety netting. Let your patients know that if something gets worse, or if you feel like you're not satisfied, come back, call us. Let there be a space where your patient know that they can tell you, because that way what happens is that they volunteer information. So if someone comes in with headache, or someone is talking to you about something and you've asked all the questions in terms of headache, and you've gotten what you need, but your environment is very safe, you just notice that sometimes they're like, oh sure, by the way, doc, so and that might be the missing piece to your puzzle. Create that safe space, both in practice when you're around your colleagues and also outside, because you're the one who has, I don't want to say the most knowledge, but you have enough knowledge to be able to help. Let people know that, okay, because people respect doctors. So you don't want to make people fear you. Like, there should be a thing that they respect you enough to come and talk to you, and just create, that safe space. That's it.
Amazing, amazing. Um, that was a enough information to that question in particular, and I believe that because one thing about this thing you said is there are a lot of doctors that are going to watch this video, and at least this is going to give them a heads up to give a platform to your patient to be free with you, to
Mm-hmm.
say what you think that's wrong with the person, so
Yeah.
they be scared because of maybe because doctors see a lot of patients, depending on the specialty. So
Mm-hmm.
the only time, like they're looking at time because there are other patients waiting. No, no, no. You just have to give adequate attention to all patients and give
Yeah.
them a to illustrate themselves and what they're passing through. So thank you so much, Dr. Adanna, for talking us through about that. So the last question is, now tell us, what advice would you give for medical students out there and healthcare professionals already in the field who want to get involved in mental health advocacy and healthcare reform? What advice do you have for them?
Well, I will tell them that there's space for all of us, you know. There's space for everyone to get into it. We even need it. The more we are, the better. We're able to push what we're trying to advocate for even further. And with medical students, I know that sometimes it's easier said than done. Like, med school feels like forever. I remember when I finished, I was like, eh? It's like I thought I'll be doing this for the rest of my life. And like I finished med school in like 2022, and I made a huge decision not to start to practice, and it was like, what? But there's space for everything you want to do. You know why you got into medicine. You know the ways you want to implement it. Please feel free to dream. It's your dream, and God has a way of making those things come alive. Go into everything that you want to go into. You can wake up today and say you want to advocate for mental health. That's fine, and continue doing it. And one day you realize that, oh wow, my passion for mental health is predominantly with children. Go ahead. Like, there's no rule. There's no rule against pursuing anything that you want to do. Just continue to do it. I know that it's easier said than done, depending on where you are, the current situation that you may be in, but just keep trying. Show up for yourself. You can start in your own little space. It doesn't have to be as big as what everything looks like on the social media these days, but start where you are. That's what I would say. Please dream big. Know what you want for your own career. Do you want to be in the hospital? Do you want to be out in the field? Do you want to be online? Do you want the three? You're the owner of your life. Well, God is, but like, you're the one who knows what you want. So go ahead and do that. And if you feel like you don't have a big reach yet, that's fine. I always say I want to make change in my own little corner of the world. I don't know everybody in the world, but if you call 5 people who know me, I want them to be able to have been impacted by my own change. So start with that, and then you see how things will just scale up as your life proceeds. So that's it.
That was an amazing advice to medical students out there and healthcare professionals in the field. Looking forward to getting involved with mental health advocacy and healthcare reform. So we've come to the end of the session. Dr. Dana, thank you for your time. Because you're a very busy person. You just, I won't say you're everywhere because, now you, you're here, the next day you're another place. So for you to have this time to have a mental chat with the audience, it's amazing. And so if you love this content, do have to share, like, and subscribe. If you have questions, you can drop it on the comment section, or you can reach out to Dr. Adana. Her details will be on the YouTube description below. So make sure you watch this video to the end. Thank you so much. Thank you, Adana.
Bye.
Yeah, amazing. That was amazing.